Thank you very much. It's a pleasure to be here. As you heard, I'm not a geriatrician, so you are the experts out here, and I hope I can give you just a little bit of help in management of some of these complex patients. So let's get going. Some disclosures. Let's start with Shakespeare. O sleep, O gentle sleep, nature's soft nurse, how have I frighted thee that thou no more wilt weigh my eyelids down and steep my senses in forgetfulness? Now, I think any of us who've had even transient insomnia can identify with that, and I'm sure William Shakespeare had insomnia himself, and with the feeling with which he wrote those words. So let's start with a case history after that. A 72-year-old woman with trouble initiating and maintaining sleep for 10 years, starting at the time of death of her husband. Fatigue during the day, but cannot sleep even if she tries to nap. And was depressed, but put on citalopram, and she says, the depression is cleared, I've got on with my life, I still can't sleep. All right, let's do the first question. Which of the following is the most appropriate initial treatment? Zolpidem, trazodone, suvorexant, doxepin, or cognitive behavioral therapy? And excellent, exactly what I hoped. 87% feel that cognitive behavioral therapy would be the initial treatment. We'll come back to that. So the objectives are to determine the factors contributing to insomnia through a brief history, describe the principles of CBTI, discuss the advantages and disadvantages of hypnotics with older people, and select the most appropriate hypnotic if you choose to use one for an older patient with insomnia. I'm going to go through my talk as tips on the diagnosis. I'm going to ask the question and try and answer when is insomnia not insomnia, and then give you hopefully a rubric for determining the contributing factors to insomnia in 5 minutes. Then the ABC of CBTI, and then a little bit on Z drugs, alternative medications, and putting it together. So how common is insomnia? 30% of us have occasional insomnia, and 10% of the population have chronic insomnia. So this is really common. It is more common in women than in men, in the elderly, which makes it very relevant to our topics today. It's commoner in people with chronic medical illness, which of course interfaces with the elderly, and in patients with psychiatric disorders. So how do we diagnose it? Well, over the years, there have been numerous classifications of insomnia, and the latest one that we work with in the sleep field is called the ICSD-3, International Classification of Sleep Disorders 3 classification, and this round has been won by the lumpers, which makes it a